I want you to take a second and just imagine the microscopic world that's rushing through your veins right now.
Yeah, it's quite a picture.
Right. I mean, billions of cells just navigating this incredibly complex high-speed transit system. And I think we tend to think of our blood as this, constant unchanging fluid, like this baseline that just sort of runs in the background.
Oh, absolutely. People think of it like water in a pipe.
Exactly. But the clinical data we're looking at today tells a terrifyingly different story. Like, what if the simple act of skipping a glass of water or, I don't know, working right through lunch physically altered the shape, the stickiness, and the very survival of those cells?
It does. It fundamentally changes them.
And that's why we're doing this deep dive today, because if you are ever relying on your blood for healing, specifically for a platelet-rich plasma procedure, like the O-shot skipping lunch yesterday might have just literally ruined your treatment today. So let's look at the physics of why.
Yeah, and to really grasp this, it requires a pretty profound shift in how we view our own biology. The environment inside your blood vessels is highly reactive to your immediate everyday choices.
Right.
So to understand how our primary healing cells, our platelets, behave, we have to look at the fluid dynamics of the plasma they live in. Plasma is the liquid component of your blood. It's mostly water, but it's packed with proteins like albumin and fibrinogen, plus a bunch of electrolytes.
Okay.
And because of all those molecular interactions, normal plasma at body temperature is already about 1.8 times more viscous or thicker than pure water.
Okay, so that's just the liquid base, right? Like
Yeah.
before we even add the cells into the mix.
Right, exactly. And once you add the formed elements, so the red blood cells, white blood cells, and platelets, the viscosity changes dramatically.
Because they take up physical space.
Yes. Red blood cells take up the most physical space, by far. If you look at a normal hematocrit level, which is just the volume of your blood that's made up of red blood cells, it sits right around 40%.
Got it.
At that 40% level, the relative viscosity of your whole blood is about 4.
Okay, so think of your blood vessels like a river. When you're hydrated, at that viscosity of 4, it's a fast-flowing, clear river. Everything moves smoothly. But if you stop drinking water, that plasma volume shrinks, right? The water essentially evaporates from the riverbed.
Exactly. And this creates a state called hemoconcentration. Your red blood cells are suddenly packed much closer together. And the really important thing here is that the relationship between that cellular crowding and the fluid thickness is strictly nonlinear.
Wait, walk me through that math. Because if it's nonlinear, it means it doesn't just scale up proportionally, right?
Yeah.
Like if my hematocrit goes up a little bit, the blood gets a lot thicker.
Yeah, let's put some real numbers to it. If your hematocrit jumps from a normal 40% up to 60% due to dehydration.
Which is mathematically a 50% increase in concentration.
Right. The relative viscosity of your blood doesn't just bump up by 50%, it doubles. It goes from a viscosity of 4 to a viscosity of 8.
Whoa. A 50% increase in cells causes a 100% increase in thickness. Why? Why the massive leap?
It's all about friction. When you pack that many solid cells into less liquid, they are constantly scraping against each other and against the vessel walls.
Ouch.
Yeah, and the cardiovascular toll is immediate. You've suddenly turned a free-flowing river into this thick, slow-moving sludge. Your heart literally has to pump twice as hard just to force that sludge through the system.
Which, I mean, that feels like trying to suck a really thick milkshake through a tiny straw instead of just regular water.
That's a perfect analogy.
Yeah.
And that increased cardiac workload leads directly to endothelial stress. Basically, intense mechanical friction on the delicate inner lining of your blood vessels.
So the pipes are getting scraped.
Right. And when blood flow becomes that sluggish and the vessel walls are highly stressed, the blood is practically primed to coagulate. The environment is sending alarm signals that something is seriously wrong.
Which brings up, I think, the most critical mechanical question here. If the blood is this thick, highly frictional sludge, what happens to the delicate platelets when they are forced through a narrow channel, say like a narrowed blood vessel, or even worse, a medical device?
This is where mechanobiology comes into play. Platelets don't just float passively, They actively feel their physical environment. Their outer membranes are completely covered in mechanoreceptors.
Wait, they literally possess a sense of touch for mechanical force.
Yes, they do. The most prominent one is the glycoprotein I/X complex, or GPI/X for short.
Okay.
Under normal, healthy, physiological shear stress, so just the standard rushing of that hydrated river, a massive protein in your plasma plasma called von Willebrand factor acts kind of like a molecular grappling hook.
Yeah.
It binds to this GPI by X receptor.
Okay, so the von Willebrand protein hooks onto the platelet as it floats by.
Yep. And the sheer physical force of the flowing blood actually pulls on that connection. That mechanical pulling physically unfolds a specific domain on the receptor. It's like pulling a tripwire. Yeah, and this safely activates the platelet, signaling it to adhere to the damaged vessel and help with natural hemostasis, forming a controlled clot to stop bleeding.
That is fascinating. The actual physical drag of the blood flow is the trigger. But what happens when that flow is completely abnormal, when the blood is that thick milkshake sludge, or say it's being spun at high speeds in a centrifuge for a platelet-rich plasma treatment?
Then you generate what's called non-physiological shear stress, or NPSS. The friction between the fluid layers becomes incredibly violent. In a centrifuge, for example, platelets are subjected to intense, unnatural forces, hitting 125 to even 300 pascals of pressure.
I have no context for pascals. Like, how violent is that for a tiny cell?
Think of it this way. Imagine standing in a mild breeze and suddenly being hit by Category 5 hurricane winds.
Oh my God.
But the wind is made of thick mud.
That sounds horrific.
It is. Even if it only lasts for a fraction of a second, this extreme stress creates a profound biological paradox for the platelets.
A paradox meaning what they react in two conflicting ways.
Precisely. The extreme pressure induces a state of hyperactivation. The platelets panic. They aggressively flip these adhesion molecules, like P-selectin, to their outer surfaces.
And P-selectin makes them sticky, right?
Incredibly sticky. They also start shedding microparticles, essentially these tiny fragments of cellular shrapnel, into the bloodstream. In a living body, this sudden shower of sticky microparticles drastically increases the risk of dangerous systemic blood clots.
So they're completely freaked out by the pressure, they bristle with this sticky P-selectin, and they basically go into overdrive. I mean, that sounds like they'd be great for a localized PRP injection, right? Because they are so primed to heal.
But that is the other half of the paradox.
Oh.
Yeah. While they are chemically hyperactivated, the physical stress is so high that it damages their structural integrity. The sheer mechanical force actually snaps the protein chains on their surface, causing them to physically shed their most crucial receptors, specifically GPI-alpha and GPVI.
So they lose the receptors entirely.
Entirely. Furthermore, the hurricane force shear breaks apart those large von Willebrand factor proteins we talked about, completely destroying the grappling hooks.
I'm trying to picture this. The platelets are hyperactivated and sticky on the inside, but the sheer stress has basically ripped off their external Velcro. The receptors that actually allow them to anchor to collagen at a wound site are just gone.
Gone, washed away in the plasma. Which means you are left with the absolute worst of both worlds. You have systemic clotting risks from the microparticles, but a severe localized bleeding risk because the platelets themselves have lost their aggregation capacity.
Wow.
They cannot form a firm, stable clot when you actually need one for tissue repair.
So, let me get this straight. If you're trying to extract platelets to heal a tissue, and they've had their Velcro ripped off in the centrifuge because your blood was too thick, they're completely useless. You're just injecting broken cells.
That is the mechanical reality of dehydration, yes.
That is wild. Okay, so physical stress, like the rapids of a centrifuge combined with thick blood, literally rips the platelets apart. But what about chemical stress? Like if I drastically alter the nutritional makeup of my blood through something like a prolonged fast, does the lack of nutrients create a similar panic inside the cells?
Oh, the chemistry alters their behavior just as fundamentally as the physics does.
Oh, really?
Yeah. The clinical data on fasting reveals a really stark contrast depending on the dosage and the duration. Prolonged fasting, for example, acts as a severe systemic stressor on the blood. The research tracks a marker called high-sensitivity C-reactive protein, or HSCRP.
Okay, I've heard of that.
Think of HSCRP as a smoke detector produced by the liver. When there's systemic inflammation, it sounds the alarm. By the end of a prolonged fast, HSCRP rises by 129%.
129%. I mean, that is a massive inflammatory alarm.
Huge. And the platelets hear that alarm loud and clear. The studies measure a very specific compound called urinary 11-dehydrothromboxane B2.
Thromboxane B2, that sounds like a chemical distress flare. What is it actually doing?
It is exactly a distress flare. Thromboxane is the signaling molecule platelets release to recruit other platelets when they are activated.
Oh, I see.
Yeah, so an increase in this marker indicates that platelets are highly agitated and prone to clumping, which obviously elevates cardiovascular risk. During prolonged fasting, this distress flare increases by 21%, and importantly, it remains elevated even after refeeding begins.
I'm really surprised by that because fasting is almost universally pitched as this profound healing tool. But you're saying prolonged fasting actually acts like a chemical hurricane that cranks up inflammatory markers and agitates the platelets.
Well, it depends on the pattern. This is where intermittent fasting presents a completely different chemical pathway. Intermittent fasting, as opposed to prolonged starvation, actually inhibits platelet activation.
Wait, how can a shorter fast calm them down when a longer fast stresses them out?
It comes down to your gut microbiome. Intermittent fasting modulates specific gut bacteria, like Clostridium sporogenes. In this eating pattern, these bacteria increase their production of a metabolite called indole 3-propionic acid, or IPA.
Wait, let me make sure I'm following this. I stop eating for 16 hours. In response, my gut bacteria start manufacturing a compound called IPA. How does a chemical made in my intestines end up sedating a blood cell in my veins?
Because the IPA is absorbed through the gut lining directly into the bloodstream. Once it's in the blood, it searches for a very specific lock to fit its key. That lock is the pregnane X receptor, or PXR, which is located right on the surface of your platelets.
Okay, the IPA binds to the PXR receptor. What happens inside the platelet?
It triggers a signaling cascade that physically alters the cell's ion channels. Specifically, it blocks the influx of calcium.
And calcium is important because
Calcium is the ultimate trigger for a platelet. When calcium floods in, the platelet changes shape, it practically turns inside out, and it gets sticky. By blocking that calcium rush, the IPA keeps the platelet calm, smooth, and functional. It drastically reduces the risk of abnormal thrombosis.
that is an incredibly elegant system. Intermittent fasting essentially uses your gut bacteria as a pharmacy to manufacture a natural calcium channel blocker for your blood.
Exactly.
What happens if we push dietary restriction to the absolute extreme? The sources we have also dive into severe anorexia nervosa.
Right. In severe starvation, the body enters a profound energy deficit, and the hematological consequences are just devastating. We see significant reductions in overall thrombocyte or platelet counts. They can drop by up to 6.6 times 10 to the third per microliter.
Does the bone marrow just stop manufacturing them?
It's not just a production halt, it's a massive energy crisis. The body is completely starved of glucose and lipids. Cellular autophagy goes into overdrive. The body is literally breaking down its own cells just to survive. And this severe platelet depletion leads to dangerous increases in bleeding markers, specifically INR and PTT times, which basically measure how long it takes your blood to form a stable clot. The blood simply cannot patch a wound.
And there was a fascinating case series in the sources about treating this specific state, wasn't there?
Yes, the researchers documented a case series where patients with severe refractory anorexia nervosa, these are patients with dangerously low BMIs that were unyielding to standard high-carbohydrate nutritional rehab, they were transitioned to a high-fat, cannibal-based ketogenic diet.
And how does shifting to a ketogenic diet fix a blood clotting crisis?
It bypasses the broken glucose metabolism. By providing abundant dietary fats, the liver produces ketone bodies. These ketones provide massive, immediate energy to the brain and body, which halts that desperate cellular autophagy. Furthermore, the heavy influx of lipids provides the exact raw building blocks the bone marrow needs to start manufacturing healthy cell membranes for new platelets again.
So providing the raw materials basically restores the manufacturing line.
Exactly. These patients achieved multi-year remission, experiencing massive weight restoration. But just as crucially, by stabilizing their cellular energy and their blood chemistry, they reported a profound reduction in severe anxiety and intrusive thoughts. The whole neurometabolic state shifted completely.
Which really proves just how tightly our psychological state is bound to the chemical makeup of our blood. And speaking of dietary composition, it's not just about fasting or keto. The specific fats we eat change platelet behavior too, right?
Very much so. High saturated fats and refined sugars fuel the production of inflammatory prostaglandins. They drive oxidative stress, leading to clumpy, hyperreactive platelets. On the flip side, Omega-3 fatty acids, like those found in fatty fish or cod liver oil, they actually incorporate themselves into the platelet cell membrane.
Oh, they become part of the cell?
Yes, they alter the lipid rafts, physically interfering with the signaling pathways that cause platelets to clump. Omega-3s are potent natural blood thinners.
Okay, we've mapped out the physics of thick, muddy blood ripping the Velcro off platelets. We've explored how fasting can either inflame those cells or team up with gut bacteria to calm them down. Now, I want to bring every single piece of this science directly back to you, the listener. Let's talk about the ultimate real-world test, prepping for a platelet-rich plasma procedure, specifically the O-shot.
Right. PRP therapies like the O-shot are fundamentally reliant on the biological quality of the raw material. And that material is your blood.
Let's define the stakes here for a second. The O-shot involves drawing your blood, spinning it in a centrifuge to extract a high concentration of platelets, and then injecting that golden plasma back into vaginal tissue. The goal is to stimulate intense rejuvenation, new blood flow, nerve sensitivity. But that entire process relies on the growth factors locked inside those platelets.
Yes, growth factors like PDGF, TGF-beta, and VEGF.
And these aren't just vague proteins, right?
No, not at all. VEGF, for example, is vascular endothelial growth factor. It is the literal biological blueprint that commands your body to build brand new blood vessels. But, and this is the catch, getting those blueprints out of the platelets requires them surviving the centrifuge.
Which brings us back to the hydration factor. If you walk into that clinic dehydrated, let's break down exactly what fails in that machine.
The failure is structural. Dehydration means low plasma volume. Your blood is a thick, highly frictional sludge. When that sludge hits the intense shear stress of the centrifuge, the lab processing physically fails. The fluid is simply too thick to allow the platelets to cleanly separate from the heavier red blood cells. You end up with a smaller, significantly less potent PRP yield.
But the cellular damage is the real tragedy here, right? We talked about this earlier.
Yes, the friction of the non-physiological shear stress on that thickened blood violently rips the GPI-alpha and GPVI receptors right off the platelets.
The Velcro is gone.
The Velcro is completely gone. And because of that structural trauma, the platelets lose their ability to degranulate. Meaning, once they are injected into the vaginal tissue, they cannot effectively crack open and release those precious VEGF blueprints. The growth factors either remain trapped or they're released erratically.
So you endure the blood draw, you endure the centrifuge, the injection, and the platelets are essentially shooting blanks.
Pretty much. Furthermore, dehydration ruins the architecture of the fibrin clot.
The what?
The fibrin clot. When liquid PRP is injected into tissue, it has to coagulate into a 3D gel matrix. It's like a temporary fibrin scaffold. This scaffold holds the platelets in place so they can release growth factors exactly where they are needed. If your plasma lacks water, that scaffold forms weakly, it collapses. The growth factors simply wash away into the surrounding tissue, and the targeted healing completely fails.
Wow. Okay, so hydration is absolutely non-negotiable. But what about the dietary factors in the days leading up to an O-shot? Are there things you should actively avoid?
Yes, the clinical data suggests a highly specific prep protocol. For optimal PRP yield, you need a high absolute number of circulating platelets. Therefore, you must temporarily restrict anything that artificially thins the blood or lowers the platelet count.
Okay.
The sources indicate restricting ketogenic diets, pausing cod liver oil, and avoiding excess vitamin D supplementation in the immediate days prior, as these can decrease overall platelet volume.
Which feels entirely counterintuitive.
Yeah.
Because omega-3s and vitamin D are universally praised for cardiovascular health.
They are excellent for daily health precisely because they prevent platelets from clumping. But for PRP draw, you don't want thin, sparse blood. You want maximum platelet density.
Makes sense. Sources also mentioned that iron deficiency and hypercholesterolemia technically increase platelet counts. But deliberately pushing your body into an anemic or high cholesterol state just to bump up a lab number completely backfires because the blood quality plummets.
Right. Exactly. Pursuing pathology for a minor cosmetic gain defeats the entire biological purpose. A focus must remain on optimizing the parameters you can safely and effectively control. That means pausing your blood-thinning supplements and absolutely mastering your hydration.
Which brings up a very practical problem. Say you're sitting in the clinic waiting room and you suddenly realize, oh no, I haven't drank water all day. Chugging a massive bottle right then isn't going to fix the sludge, is it?
It is much too late. Recall the nonlinear viscosity math we did earlier. Mild dehydration changes your whole blood viscosity in just 4 hours, but rebuilding intracellular and plasma volume optimally takes significantly longer. The clinical insights dictate that you must begin systematic hydration 24 to 48 hours in advance.
And is just drinking plain tap water enough to rebuild that plasma volume?
Actually, no. Water alone is inefficient. The studies highlight that electrolyte glucose beverages, or EGBs, are demonstrably superior in preventing blood viscosity spikes.
I'm guessing that has to do with the chemistry of the plasma itself?
Exactly. Plasma is an osmotic environment. It requires specific ratios of sodium, potassium, and glucose to physically hold water inside the vascular system. If you just drink plain water, your body often just flushes it right out to maintain the electrolyte balance.
Ah.
EGBs, on the other hand, provide the exact osmotic gradients needed to pull water into the bloodstream and keep it there. They prevent hypovolemia or low blood volume far better than plain water.
So the biological reality is completely unforgiving. If you don't prep your internal environment, the centrifuge will subject your thickened blood to violent shear stress. It will rip the receptors off your platelets, destroy their ability to release vascular growth factors, and render your incredibly expensive O-shot essentially useless.
Yep. The clinician can only work with the raw materials you provide. Your lifestyle in the 48 hours prior literally engineers that material.
Let's take a breath and recap this, because we covered a lot.
Yeah.
We started by exploring the physics of the river, how dropping your fluid intake packs red blood cells together, turning a fast-flowing stream into a high-friction sludge that literally doubles your blood viscosity.
Right, and then we looked at the violent mechanics of a centrifuge. How subjecting that sludge to non-physiological shear stress creates this paradox. Hyperactivating platelets while simultaneously ripping off their adhesive receptors, leaving them structurally broken.
Then we moved into the chemistry. We saw how prolonged starvation sounds a chemical alarm that agitates platelets, but how intermittent fasting uses our gut bacteria to manufacture a natural calcium channel blocker, keeping the platelets calm. And finally, we applied all of this to PRP therapies, proving that you have to hydrate with electrolytes 48 hours in advance and pause the omega-3s just to ensure your cells survive the centrifuge intact.
It really forces us to recognize just how exquisitely sensitive our internal systems are to external inputs.
It does. Which leaves me with this final thought for you to mull over. If everyday, seemingly mundane habits, like the exact hours we choose to skip a meal or the specific ratio of sodium in our water, can physically unfold mechanoreceptors on our microscopic cells, dictate gut bacteria communication, and completely change the architectural integrity of our blood, how much untapped conscious control do we really possess over our own biological engineering? The blood flowing through you right now isn't a static baseline. It's a living, reacting river, and you are the one controlling the current.